The Isaiah Factor Uncensored starts right now.
And welcome to The Factor Uncensored. Disparities among minorities are well known in the medical community. Some black patients say doctors don't believe them when they talk about their symptoms or pain. The lack of equitable treatment also applies during this pandemic when it comes to those who are being treated for COVID-19. Now, a Houston woman says she was 40 days into a coma, and her family was told to make final arrangements until her mother stepped in and found a health advocate. Take a look.
And joining us now here on The Factor Uncensored to talk about advocacy for patients when they're dealing with COVID, we have some medical professionals, and also we have with us Pamela and Ashley Bennett. Ashley, you almost died of COVID-19 back in March. Tell us a little bit about your situation and what happened.
Okay, I work for a government agency, so I was classified as an essential worker, and I ended up having COVID. I was in the hospital. I was hospitalized for not breathing, and immediately within the 3 weeks of me being in the hospital, I got trached and was on life support and was in a coma.
Pamela, that had to be very scary for you with Ashley in the hospital like that. And she was in a coma, for 40 days?
It was very scary. When she called me and told me they admitted her to the hospital, she had children at home that had also had COVID. So I had to make a choice, go get my kids, go get my grandkids, put my life in danger, but I'd already had the vaccine. So it was scary, and it was a lot of things that I had to make decisions on quickly.
Ashley, did you have the vaccine or
no,
not?
No, I hadn't had the vaccine. No,
Do you think that played a significant role on the severity of the COVID you had by not having the vaccine?
Well, I'm unsure about that, but I was in a perfect health person. So for us, I didn't have any medical background, no bad medical background.
And so, Pamela, the doctors addressed you about the situation, but you needed some help. And so what did you do?
I needed some help, and I was at the pharmacy, and I had told the pharmacy what was going on in my life, and he told my friend, Dr. Wyatt.
Dr. Wyatt, we want to welcome you to The Factor Uncensored. You said medical advocacy, health advocacy is important in a situation like this, especially when it comes to minorities dealing with COVID. So tell me explain why you need an advocate.
Well, it's imperative that many of us, especially those of us that are of color, need someone with the medical background to speak on our behalf. There are a lot of racial disparities going on right now in the healthcare field, so it definitely helps the patient and their loved ones to understand what is going on with their patient with COVID. And then there are a lot of difficult choices that loved ones have to make on behalf of the patient. And so they need to fully understand the gamut of what's going on with that COVID patient to make the right choices for survival.
Dr. Wyatt, what did you recommend for Ashley while she was in that coma? Many people would have written her off by now.
Well, she was written off. She was written off. Basically, I spoke on behalf of Ms. Bennett, and they told Ms. Bennett that to make her arrangements. And I said, oh, wow. No, she'll come home. She will come home. She has 3 children. They had other family members that had passed away with COVID that is very young. Ashley's in her 30s, and that is very young to have 3 other members pass away. And I just had to go in strong advocating for Ashley's life. And that's what I did. I let them know that she needed monoclonal antibodies immediately and all of the other factors that needed to come into play. There are a lot of medications that need to really be brought on board quickly, expeditiously, to knock out this virus.
Now, when you talk about monoclonal antibody treatment, that's what Governor Abbott had. That's what President Trump had. Obviously, the average person, they're not being offered that in the hospital. Is that the case? Why did it take an advocate to do that, Dr. Mo?
Well, that's actually the case. Most people don't all those monoclonal antibodies. And we don't know exactly why the government seems to be pushing more of the vaccine and at least having some therapeutic regimens that could be given to a patient, especially a life-saving therapeutic regimen. Because if you get those monoclonal antibodies, the situation could be reversed in 24 to 48 hours. So it might be a little bit about money from the federal government, but now I think they're pushing for more money to be put into therapeutics so that all these monoclonal antibodies and drugs that inhibit the replication of this virus can be made available to the general public.
Now, Dr. Mo, you're not, though, insinuating or implying that people should not still get the vaccine, right? But you're saying if someone becomes ill, get them this therapy as soon as possible, because even if you get the vaccine, it's not 100%.
That is correct. No, we're not saying people should get the vaccine, but we're saying that people should know what to ask for sometimes when they're in that their situation. Because these monoclonal antibodies should be made available to anybody in a serious situation like we have here. And it's really life-saving.
And of course, I want to re-emphasize once again, no one is saying not to get the vaccine. They're saying once you get the vaccine, and if you still get COVID, or if you get COVID anyway, just ask for additional medical advice or what's available on the market out there. We're not saying do not get the vaccine. Absolutely not. I have the vaccine. Our conversation with the group continues after a quick break. Up next, we ask what medical treatment should have happened before Ashley fell deep in that month-long coma. She also shares what she is still battling after surviving the disease. We'll be back with more Factor Uncensored in just a moment. Don't go anywhere. We have some important information headed your way. And welcome back to the Factor Uncensored. Ashley Bennett battled COVID-19. She says she was in a coma for weeks before she was finally given the monoclonal antibody treatment. Now, the woman her mother met that finally became her advocate is a pharmacist who gave them the life-saving advice Ashley was being written off. We hear from that pharmacist on what should have happened, and Ashley shares what symptoms she is still dealing with today.
Now, Dr. Wyatt, when we take a look at Ashley's case, and she was 40 days in a coma, you're recommending if someone tests positive, you immediately get the therapy, begin the process, right?
Well, definitely you need to begin some process. Monoclonal antibodies, typically you have to go in to get them, but a lot of people are not just starting off with the basic things that they can do, which is to, number one, contact your doctor, your physician immediately so they can get some prescription medications on board, before you get to the hospital or the emergency room state. So once you get to that emergency room state, then yes, then you definitely need to advocate for monoclonal antibodies.
Ashley, obviously you're here today. How thankful are you that you had this advocate to come in for you and save your life?
I'm very thankful. I appreciate everybody that stepped in and prayed for me and all the things that the people have done for me, for as Dr. Wyatt coming in and stepping in and being with my mom at that time and suggesting different things. I appreciate everyone deeply.
How's life now? Do you have any difficulties breathing? What are some of the issues? Because when I hear you talk, it seems a little bit labored. What are some of the lasting impact that you still have from COVID?
Okay. Well, right now I'm currently dealing with enlarged heart and severe lung damage. So my breathing is getting better, but it's still like if I get up and try to walk from one end of a room to the next, I'm completely winded. Or to even sing a song.
And you're still on oxygen.
And I'm still on oxygen as well. And doing therapy, trying to get better at it. Also, I experienced brain fog, My hair is falling out due to COVID. It's called COVID hair. I'm experiencing a lot of different symptoms.
But the important thing is she is alive today. Dr. Mo says one important thing you can do the moment you find out you're positive for COVID-19 is to work to boost your immune system. There are various foods and vitamins that you can take to do that, but you should talk to your primary care physician before taking any action. And also remember that the vaccine is out there for those who need it.